Hi there, welcome to my page. Thank you very much for those people who are following my page, for liking and sharing it. The numbers are growing, which is good, so I just want to try and get the word out there more. So today we're just going to take the time to talk to you about the beginning of my cancer, the steps that happened and the diagnosis. So back in 2016 we were living in a small country town called Claremont, which is about 400 k's west of Rockhampton, Australia. I had noticed like a small rash, a redness on my left breast, just where the bra sits. Never really thought anything about it. It was just something that was there. We lived in a hot old place. Just thought it really just looked like a heat rash. It wasn't until I noticed a pea-sized lump that I went to the doctors. And the doctors did an ultrasound on my breast, and it was just a cyst, nothing there. It was a benign cyst, so nothing further was done. Then we moved back to Brisbane, as my little man needed better treatment for his autism. There was nothing in Claremont that really could help him, so we noticed that this little cyst went from this small pea size to the size of an orange within a couple of weeks. The rash had increased so much and really looked different to a normal rash, so we got a biopsy done. The clinic who did the biopsy took out all the fluid in the cyst and scrapings underneath the cyst. We had gotten the results back because the results went back to Claremont doctor, so they actually sent us the results. So we got the results back and it had said that they were abnormal cells. So we wanted to go to the doctor, so we went to the doctor, and I personally wanted the doctor to tell me I had cancer. So I just remember him just sitting there saying, "Look, darling, you know what your results are, and that we need to refer you through to a breast surgeon." And I said to him, "So what were the results? Can you tell me what these results are?" And he kept saying, "You know what the results are." It wasn't that I knew that they were cancerous. I wanted a professional, a doctor, to tell me that I had breast cancer, which he just could not. I don't know if he had the heart to tell me. So Nate turned around to me and said, "Babe, you have breast cancer." It still makes me laugh that my own doctor couldn't tell me that I had this breast cancer. So we don't actually see this doctor anymore. So we went to a different doctor now who's just amazing. So that doctor's appointment was on a Saturday morning, and our specialist appointment with the breast surgeon was made for the Wednesday, and his name was Dr. Wong, and he was just absolutely amazing. He did heaps of tests, CT scan, full bone scan, mammogram, and finally an MRI. Dr. Wong had told me that I had inflammatory breast cancer, triple negative, stage 3B. That I had lymph nodes in my arm, or in my underarm, that were affected as well. So they were part of the diagnosis. So I had inflammatory breast cancer, which is a rare and a very aggressive disease, in which cancer cells block lymph vessels. That's why I had this massive fluid in the cyst build-up. So only about 1% of women who are diagnosed with breast cancer have inflammatory breast cancer, which is quite scary. He told me that I need to see an oncologist to do chemo to shrink the cancer, as it was 9 centimetres long and was very close to my chest wall. Then we would do the mastectomy and then radiation. I'd already decided this time that I would, I wanted to get a double mastectomy. There was no option of just taking the cancer side out or just having one side removed. I did not want boobs anymore. I did not want the chance of it coming back to the other side, having to do mammograms all the time, being scared that every lump in my other breast was cancerous. So I said back then that I really want a double mastectomy. So then Dr. Wong rang me late Friday afternoon. He'd already made an appointment for me to see the oncologist called Dr. Grimes. He was just brilliant. He told me straight up that the cancer I had was shit. you're already in stage 3B because it's already gone to your lymph nodes, which most of inflammatory breast cancer is already, when it's found, it's majority of the time it's already stage 4, but usually it starts at stage 3. So he said I wanted to start chemo, and he had me coming in to start the chemo regime probably on the Tuesday after the Friday night. So the treatment that he gave me was called TAC, and this was on every 2 weeks for 6 cycles. We were so fucking scared. Sorry, we were really scared. It was the worst news that we could ever have been given. Holy shit, everything was spinning. Yeah, it was a terrible, terrible time for both myself and for Nathan. We just did not expect it to be so bad. The Dr. Grimes gave me heaps of pain medication scripts so that through the whole process he never wanted me to feel pain at all. So it just felt like the whole world had just crashed down at me. Everything was spinning so fast, and I just wanted this to stop. We had this stage where our babies were only 2 and 3. All the questions were, holy cow, how do I explain to them they've got breast cancer? How do I move past that point? And they were the things that helped me through the whole process. So on the first day of my treatment, I remember that I stayed there for ages. People came, got their treatment and left, and I was still sitting there going through mine. I think I had 3 bags that I had to go. So I had the Red Devil, which is a red thing, part of the TAC program that they put in your hand. It burned like crazy. And then the other 2 bags of chemotherapy. So this happened every 2 weeks. So on my first treatment, I decided to stay in hospital for the night. I just cried and cried. My head was still so spinning. But I decided that I needed to take control and start appreciating my life and making the most of it. To this day, I would never wish this on my worst enemy. It was disgusting. My taste went, my hair went. I felt like absolute crap. So we were really lucky. We had great support from family and friends, as I don't think we would have been able to do what we did without them. Nathan had to go back to work, and I think the hardest thing for me was not being there for my kids. They had to go to daycare on a full-time basis. It killed me. I was a stay-at-home mum. It was my job to look after them, so I wasn't able to do that anymore. And I felt so useless. It was just horrible, horrible. So I managed the first treatment okay. We went and did a drive for Donna Day where my friends had raised some money for me, so that was beautiful. I put some of those pictures up as well. We all dressed in orange and we went for four-wheel driving. It was just so much fun. I think I slept some of the ride because I was just so out of it from the chemo. The second lot of treatment really knocked me on my ass. I became neutropenic. This is happens when you have very low white blood cells. So your chances of fighting infection is minimal. So you get all the colds and everything. So I started getting temperatures and everything like that. I remember going to hospital and the doctor was like, "You're not sick, you're still smiling," and was not going to do any further treatment with me. But another doctor came up and said, I just got this gut feeling, we need to order some tests. And my levels were really low. I got transferred to Wesley Private, where my oncologist could look after me more. And I was given antibiotics, an injection to increase my production of white blood cells. I was also given a blood transfusion because my hemoglobin levels were extremely low as well. So that was quite scary. I stayed in there for a few days and then went back home. We'd noticed that my cancer had started to break through the skin, so the skin was actually splitting and it was coming out of there. It was visible. I had to get this dressed every night. Nath was amazing through this. Didn't bother him at all changing the tape for me, but I'm sure it looked absolutely gross and it was just disgusting and it felt terrible. So I had another cycle of treatment. My treatment went, I had to go to hospital because I became neutropenic. On my 4th treatment, I went to hospital via ambulances, became neutropenic again and septic. I was vomiting, had low blood pressure, high temperatures, everything. And again, I had to stay in hospital for a few more days. I had another blood transfusion, antibiotics, had IV Panadol because I couldn't keep anything down. and it was just terrible. I just started to look like crap and absolutely feel like it. And I just missed Nathan and the kids so much. It was so hard. I had photos being given to me, a nice blanket that Nathan had made for me, a pillow that Morgs had made for me, just with pictures of my kids and my family and just all the fun times that we've been through recently. So that was nice, but nothing beats being home. So then by my 5th treatment, I remember that I was having so much trouble breathing. I had really high temps and a really nasty cough that I just couldn't shake. So I rang Nath, he was at work, and he rang my oncologist and said I needed to go to hospital again. So my friend Kate took me to the Wes, where I got further treatment. I found out that I had gotten pneumatitis from the chemo, which is a side effect of this particular chemo, and about a 1% chance of getting it, and I happened to get it, so that was nice. I was on IV steroids, had another transfusion, stayed in hospital for around 9 days again, and I was sent home just before Christmas on steroid tablets, but my oncologist told me that I couldn't continue with the chemo, so I missed out on my last cycle of chemo, which I was happy about because I just couldn't handle it anymore. But he was really happy that the cancer had shrunk, had gotten rid of most of it. I still had a couple of lymph nodes that had 1 or 2 lymph nodes that still had cancer in it, but I think there was about 10 all up that were affected by it. So I had all, then I went for my double mastectomy, which was in January. Had a full double mastectomy and a full axillary clearance on my left side, so they took all my lymph nodes under my underarm. So I get a lot of lymph build up. My arm gets a bit swollen, but I usually manage with a compression garment, which is really good. So after my mastectomy, I stayed in hospital for 1 night. I was sent home with drains attached, which was yuck, and the kids thought it was funny because I was bleeding into them, and they just laughed all the time. But it was a hassle, but it was good to be home with my family and friends. So this healed quickly, and you can see on my photo that I'm going to put up the difference there was, and I was super happy with the outcome. It didn't look gross. I've seen some people who have double mastectomies who've got lumps and bumps everywhere, and mine was pretty flat. Within 4 weeks, I was seeing my radiation doctor and started radiation treatment. There was 25, so 5 days a week, 5 weeks. This I hated. It hurt and was uncomfortable. The treatment that had stopped within a couple of weeks. After that, most of the burn had gone, and even now I still have the marks of the radiation damage. I had to go to physio because the radiation had damaged most of my muscles. My arm movement was reduced, so I had to get that back and stretch, and then I had knotting, and it was just, I went through the mastectomy, I started to get movement back, but then the radiation just damaged it so much, it was just shit. So now it's 3 years on, I am a survivor. I will never like to do it again. I think about cancer coming back just about every day, but that is something that I will always have in the back of my mind, something that I'll always think about. But the good thing is, I'm no longer on any medication. I've just gone through my breast reconstruction, and so far this is my story. If you have any questions, please ask. I really enjoy getting the message across to many people, just to explain, help them, educate them about cancer, breast cancer, inflammatory breast cancer, having a double mastectomy, how it was. It wasn't that bad. I missed my boobs. It's amazing how boobs can be such an important part of your life, and then to have them taken away from you was just terrible. So having this breast reconstruction was really good. I feel a lot more like a woman again, which is just lovely. So thank you for listening, and hopefully I'll catch you again soon. So thank you so much.